Hi, everyone, and thank you for joining us today for the COVID-19 Vaccine Education and Equity Project webinar discussion around overcoming vaccine hesitation, particularly among Houston's diverse population. I'm Karen Jones, President and CEO of the National Caucus and Center on Black Aging, NCBA. My co-conveners for the COVID-19 Education and Equity Project are the Alliance for Aging Research and Healthy Women. With over 200 partner organizations representing patients and family caregivers, diverse communities, healthcare workers, older adults, veterans, frontline workers, manufacturers, retail, and scientists, we aim to serve as a trusted resource about the clinical trial process, regulatory review, and equitable distribution and access to COVID-19 vaccines. Our initial funding for this project was provided by Pfizer, Johnson & Johnson, and Novartis. However, our efforts are only focused on COVID-19 vaccine education and equity, and we do not advocate for any particular vaccine. Prior to my role at NCBA, I served for 8 years in the Texas legislature representing District 120 in San Antonio. I'm a native Texan with very strong Texas roots, and I'm thrilled to be joined today by an exceptional panel of speakers who will share the work that is taking place to increase vaccine uptake in diverse communities across Houston, address some common questions about COVID-19 vaccination safety, access and availability, and most importantly, combat misinformation. Before we hear from our speakers, a bit of housekeeping. First, this webinar is being recorded and will be accessible on the COVID-19 Vaccine Education Equity Project's website at covidvaccineproject.org. Second, throughout today's live discussion, we encourage you to use Facebook Live's chat function to submit questions to our panelists. As we move to the final portion of the webinar, I'll pose many of these questions shared in the chat as time permits. To start today's webinar, it's my pleasure to share a message from Representative Kevin Brady.
Hi, I'm Congressman Kevin Brady from the great state of Texas. The COVID pandemic has tested us all in ways, we've never imagined. Over 600,000 Americans have tragically lost their lives from this virus, and we're still seeing some new deaths each day. But thanks to the dedication and hard work of scientists, researchers, doctors, volunteers, taxpayers, and many others, we've made tremendous progress in fighting this virus. We now have multiple life-saving vaccines that were developed in record time, thanks to Operation Warp Speed, spearheaded by the Trump administration. I am vaccinated, and I encourage all Americans to do the same. We're close to beating this thing, and you can help protect yourself and others from COVID by getting the vaccine. It is safe, it's effective, and it's free. You and your loved ones can get vaccinated by visiting vaccines.gov to find a provider nearby. So here's what we know. Vaccines have slowed down the rate of hospitalizations and deaths dramatically, and we all want to keep it that way. Vaccines have also helped us to get back to our routines, allowing us to gather with friends and family after so many months of adapting to a new norm. It's about returning to school, returning to work, returning to health, returning to normal. COVID vaccinations have also been key in sustaining our recovery from the pandemic, allowing our Main Street businesses to reopen their doors after so many months of forced closure. So as we see new, more contagious strains of COVID emerging, the single best thing you can do is to get vaccinated. If you have concerns or questions, talk to your doctor. Talk to someone you trust. I believe our brightest days are ahead, and we are going to beat this virus together. Let's all do our part, keep everyone safe, and finally get back to normal and to our lives. May God bless you all.
Thank you, Congressman Braley, for that important message. I am now thrilled to introduce our next speaker, Houston's Mayor Sylvester Turner. Mayor Turner was elected in 2015 and is serving his second four-year term. Before serving as Houston's mayor, Mr. Turner served for 27 years as the representative for Texas House District 139, which I had the honor of serving with him during my tenure there. Mayor Turner today will provide an overview of the effects taking place across the city of Houston to encourage COVID-19 vaccination, including clinics in underserved communities, education events to confront the misinformation, and the partnerships with trusted community leaders and religious groups aimed at encouraging as many Houston residents to get vaccinated as possible. Mayor Turner, welcome.
Thank you so very, very much. And Karen, it's good to be with you again and reflecting on our days in the legislature, and now we meet again. Look, I'm honored to join this very distinguished group of panelists. I've been looking forward to it. So certainly honored to be with Janez, president and founder of De La Latina, and then Dr. Andrea Caracasas, the chief executive officer of Hope Clinic. I've worked very closely with both of them. And then I'm looking forward to today's conversation with Karen Jones, president and CEO of the National Caucus and Center on Black Aging, and co-dean of the COVID-19 Vaccine Education and Equity Project. Look, since the beginning of the COVID-19 pandemic, the city of Houston has been very thoughtful and deliberate in how we talk to communities about the virus, testing, and now the vaccines. Communities of color across our city, like the rest of the nation, have been hit disproportionately hard by COVID-19, particularly in the African American and Hispanic communities. With the availability of approved vaccines, it became essential to address the concerns many people of color have about the vaccine due to various historic and cultural factors. And let me just say, I'm not just talking about the people in the city in general. I'm also even talking about members of my own family who in some cases have been reluctant and hesitant to take the vaccine. And so a lot of conversations have been taking place even within the family. The city of Houston launched a campaign to combat vaccine hesitancy and to educate communities of color about the vaccines. Early on in April of 2020, I appointed a health equity task force, and it worked with trusted local health professionals on a variety of initiatives, including vaccine conversations, and we promoted targeted ads and written materials. We utilized influencers and well-known celebrities like Olympic gymnast Simone Biles, Astros player Carlos Carrera, and rapper Slim Thug to speak directly to people and encourage them about getting masked up and taking the vaccines. Our themes for these conversations was, quote, get the facts, share the facts, stop the rumors. Our theme was, quote, take your best shot. And I challenged our Houston Health Department to be creative in how we educate the public. We have established pop-up vaccine clinics at clubs and bar, and I mean nightclubs, okay? And not just set them up. As the mayor of the city of Houston, I've returned to the clubs myself. I left them years ago, but to encourage people to get the vaccines, I have been at the clubs late at night. And let me tell you, it has worked. We've had people with their drink in their hand come over to where the vaccine was taking place, and then they will leave and go and get their boyfriend and girlfriend and bring them with drink in hand to get their vaccines. We've been at restaurants, churches, barber and beauty shops, and flea markets. And now we're working with school districts as students, staff, and educators prepare for back to school. We have announced this month as our Super Saturday vaccination days. And we've moved away from the big mega vaccination sites to small and more focused in communities of color. We did that early on because we set up those mass vaccination sites, but they were not creating equity in terms of the distribution. So we went to smaller in the community's locations. Our health department consistently prioritizes access and equity in our COVID-19 response. Initially, the Take Your Best Shot campaign is a direct outreach to those most heavily impacted by COVID-19, communities of colors, seniors, and older people with underlying health conditions, healthcare workers, and first responders. Now the focus is on that younger demographic. And although the health department's primary message is about the need to get vaccinated, the campaign also urges everyone to adopt a sense of personal responsibility to get vaccinated in order to protect themselves and their family members. We are using the CDC's COVID Community Vulnerability Index, CCVI, to identify Tier 1 and Tier 2 priority zip codes. We offer free vaccinations at our health clinic and several multi-service centers, primarily located in underserved communities. In addition to the many pop-up vaccination sites weekly, our in-home vaccination program brings vaccines to qualifying older adults, people with disabilities, and veterans. And lastly, we just launched an incentive program that provides people who get fully vaccinated at our eligible sites gift cards, and we provide community organizations, trusted voices, toolkits to help carry the message. And now we're also starting a new marketing initiative informed by very granular data that would include paid TV, radio, print, digital, out of home, and other advertising and trusted voices partnerships. And then as I go around the city, and I go pretty much 6-7 days a week, now my message to people, especially even in communities of color, don't live a life of regret. And what I mean by that, don't wait until fail to get the vaccine, end up in the hospital sick, and then from your hospital bed, encourage other people to get the vaccine and then say you wish you had done it as well. So my statement to people now, don't live a life of regret. Don't just think about yourself. Think about your family members, your friends, and your children. So take it. It works. I took it. And quite frankly, when they offer that booster shot, I'll be in line to take that one as well.
Thank you, Mayor Turner, for sharing some of your efforts that are happening across Houston to promote COVID vaccine and the confidence that we need to increase people in taking it. And your efforts are really appreciated. Now I'm pleased to introduce our next speaker, Janez, President and founder of De La Mujer Latina. In addition to her work through Dia La Mujer Latina, Ms. Janez has also served as the faculty member of Baylor College of Medicine in Houston, Texas, where she taught cultural competence and health literacy, as well as conducted research on Latino medical mistrust. Momentarily, Ms. Janez will share details about the work her organization is doing for the underserved Latinx communities to support vaccine uptake and combat misinformation through training promotadores de la salud and community health workers on the importance of COVID-19 vaccination, reducing barriers to vaccination, and creating an opportunity to educate community members and address widespread concerns. Ms. Janez.
There you go. Okay. All right. Thank you so much, Karen. For over 2 decades, DML, we'll say DML for short, has been focusing on what we call the MIND framework. M, for motivating our community to receive much needed early detection screening. The I, for informing them about the available resources in a culturally and linguistically appropriate manner. And for navigating them through the complex healthcare system that we have in this country. And E, for the educating them about health and wellness via our promotoras and community health workers. And just to give you an idea of what we've been doing, in April, well, actually in February of 2020, we developed our first community health worker training on COVID-19 way before there was any talk about shutdown or pandemic. We were there. Our training was approved by the state of Texas, and we started training. By March 5th, we had already trained about 3,000 people nationwide, but mostly here in Houston and in Texas. And we have been in April of 2020, we had already 10 hotlines set up, had delivered our state-sponsored training module on contact tracing in both Spanish and English, where we send that to CDC and other government agencies, including the city of Houston and Harris County. We have launched now the Telehealth Community Navigation Contact Center as a way to debunk some of the misinformation that's going on in this country. And, I want to say COVID-19 has exposed our nation's lack of preparedness due to the undervaluing of its grassroots, faith-based and community-based organizations. We know firsthand what our community needs, and we don't go by outdated research. We know on a day-to-day basis. And so promotores and community health workers, they're already trusted members in our community. They are trained on communication and interpersonal skills, capacity building and service coordination skills, and many have been prepared since February 2020 to handle the pandemic. But we're still not invited to the table to be part of the plan of action. Most of our outreach material has been developed for the 15% Hispanics, but not for the 85% Latinx population in this country. And I'm part of the SEAL program, the NIH SEAL program, and I brought this to their attention that some of these forms, these consent forms, are translated literally, and they're horrendous in the translation. So part of our work is really backtracking and going through some of that education and training and focusing on communicating in a culturally and linguistically appropriate manner. We're getting hundreds of calls in our call center. We are inundated every time there's breaking news. We get all the calls, but we don't have an area or a number to call like CDC or FDA to get information in real time. And that's been some of our challenges, but we're taking care of our community day to day.
Thank you so much, Venus, for you and for your organization's work with the Latinx community to combat misinformation and encourage those vaccinations. And as they say, last but not least, our final speaker is Dr. Andrea Caracostas, Chief Executive Office of Hope Clinic. Dr. Caracostas has over 10 years of experience working with migrant and community health centers serving special and vulnerable populations. Dr. Caracostas worked as a provider at the Migrant Health Center and served as a consultant to the Migrant Clinicians Network, providing technical assistance to community health centers around the country. In just a few moments, she'll discuss the efforts made by Hope Clinic to support Asian and Arabic American communities during the COVID-19 pandemic and increase vaccine uptake through pop-up events at local schools and community centers, manufacturing plants, and apartment buildings. Dr. Caracostas will also touch on Hope's Clinic's work with the refugee community in partnership with the YMCA, and an important role in trusted community messages played in increasing vaccine confidence. Thank you so much for joining us today.
Good morning. Good morning, Mayor Turner. And I have to point out that he took his second dose with Hope Clinic. And well, Hope Clinic is a Houston provider of healthcare services that really focuses on the multicultural communities of Houston. Our patients may have no majority. We have about 30% the Asians, 30% the Hispanic, and 30% the white and African American. So really, we represent the diversity of Houston. And with that diversity comes the challenge of reaching people in language and in a culturally sensitive way, like Venus mentioned. So we have the advantage of being a front care provider. So patients do trust their doctors, and it's really, really critical that doctors encourage their patients to get vaccinated, that they set the example of vaccination. And we have really worked with the community to reach, to do grassroots work. There's so many different cultures and microcultures in our city that you have to work. We worked with the India House, the Vietnamese medical physicians, the Vietnamese Nurses Association, the Pakistani groups, so many cultural groups that really, with one focus, having one message. I think it's really critical that we all have one message when we talk about vaccines, and it is vaccines are safe, vaccines are important, and now in particular, vaccines will save our children's lives. And this is really critical because right now, the only group that remains unvaccinated is those children 0 to 12. And we are responsible for our children's lives. And I think that that's the message that we really need to take right now, that we hold the key to keeping our children safe. And we have the obligation as adults to vaccinate ourselves and to vaccinate children 12 and above. So Hope Clinic has certainly, done its share of events in hand-to-hand with the city in many occasions, as well as like this Saturday, we vaccinated 40 families, children and adults, and not only for COVID, but also for all the other vaccines that the children need protection for. So let's not forget, COVID is one step, but we have many other diseases that our families are facing, and we need to protect them from all of those. Lastly, I just have to say thank you for having me in this event, and thank you for allowing us to really, have one voice when we speak out for vaccines.
Thank you, Andrea. Thank you, Andrea, for discussing this important work and in discussing how you're reaching the Asian and Arabic and refugee community. That's very important. So now we'll transition to answering questions from our attendees. We already have great questions already in the chat, so let me start with that. Mayor Turner. How can individuals in Houston access vaccination clinics or find additional information on where to receive their COVID-19 vaccine?
They can, Karen, they can reach out to our City of Houston Health Department. They can call 311. We make it very easy and accessible. Quite frankly, there is a vaccination place in close proximity, wherever you live in the city of Houston. You can go to any one of the pharmacies. You can go to Hope Clinic. Like I said, you can reach out to DML, but readily available every single day. And I'm including Saturdays and Sundays. We are out throughout the whole city on Saturdays, like I indicated. The entire month of August is Super Saturday Vaccination Day. And just like the mayor's back to school program that took place this past Saturday, over 500 people at that one location came and received their vaccination. And what we are noticing in the city of Houston is that there is an uptick of people that are going out and getting their vaccination. So that's the good news. Now, conversely, the bad news is still that only about, let's say, between 35% or more of African Americans and a little bit more for Hispanics have gotten the vaccine. So there's a large population there of people of color who have not gotten that vaccine. And let me tell you, this past, and I want to say this because people need to know, this past Saturday, I went to a funeral. Well-known person chose not to get the vaccine, passed away. Another friend of mine that I know, I grew up with, he was a personal trainer, said he was in good shape, thought he was going to be fine. Person of color, African-American, didn't get the vaccine. His funeral is this coming week. So that population of African-Americans and Hispanics, well more than, let's say 6% of them have not gotten the vaccine. And I want to encourage them too, but you can go 311, you can call the Houston Health Department, you can go online, you can call a pharmacist, you can go to Hope Clinic, you can go to a DML, any one of these organizations. No line, you don't have to wait, readily available, and it's free. Okay, if anyone's trying to charge you something, leave them alone, but readily available. And we are in these communities on a daily basis. And if you are at home and you can't get out, if you call the City of Houston Health Department, we will come to your home and give you the vaccine.
Very good. And that's a message that we continue to try to serve across the country. Let me ask you, Venus, through your work, how have you leveraged community healthcare workers to promote vaccine confidence and encourage members of the community to be vaccinated against COVID-19? And are there trusted messengers in Houston area that you've been successful in convincing to be a part of this effort?
Yes, thank you for asking, Karen. Just in the last year, we trained 4,220 community health workers just in this area, just so they can understand how to communicate that message that is so important for our community. There's so much misinformation, and that's why we started the call center, is because we realized that there was misinformation coming from the federal government, from other local leaders, politicians, you name it. But unfortunately, the people were getting more and more confused. And when they got confused, they decided not to do anything at all. And just to give you a case in point, a couple of Saturdays, we had an event, a health fiesta, which is our way of really getting to, we had over 500 people just in those 4 hours. And we were threatened to be shut down by Harris County because of the crowd control. And this is the only way that we can get to our community, is when we have these cultural events. And I understand, we are in code red, but at the same time, this was a missed opportunity we had 202 people that signed up for the vaccine in our Latino community, and only 40 got it because they shut us down. And this is what I'm really concerned about. But luckily, Mayor Turner, you're going to like this. We're coming back to Magnolia Multi-Service Center. We know where to go now. We're going to Magnolia Multi-Service Center September 18th to capture over 200 people that we had to turn away that day. So we are getting to our community. The message is right on. And the people, our promotoras and community health workers, they're unbelievably, the labor of love is unconditional. I just love working with them. They're very dedicated to our community. Many of them have lived their system and cultural barriers that we're experiencing now. So they understand what happens when you are hit with some sort of an ailment or disease or infection and you don't have accessibility. And that's one of the key things that we have seen during this whole past year is the lack of accessibility. Many of our folks lack transportation. And I want to give a shout out to the National Council of Negro Women, who came up to me and said, we'd like to donate Uber rides for you. I mean, it took another organization to come to us and to offer that for us to be able to provide that transportation that is so desperately needed on Uber to come to our health fiestas. So these are just some of the challenges that we're realizing right now in our community. But, those trusted members, those promotoras and community health workers, they are working amazingly well. Our call center also has a telehealth community nurse navigator who is taking on all of the clinical type of questions. And we're setting up a telemedicine program within our TCN program, just so if the nurse navigator can't answer the question, she'll warm transfer that to that group of medical doctors ready to help, all free of charge.
Karen, can I add two things right quickly? One is that I want to give that telephone number because many people can't go online. They may not have the device. So let me give a telephone number too, 832-393-4220, 832-393-4220. 4220, or they can go to houstonemergency.org. And then lastly, now, Venus, I just want to be clear, that wasn't the city that shut you down now. That wasn't us.
No, it wasn't. No, you saved us. You saved us. Yeah, we were being shut by Harris County. I mean, that's exactly what happened because of too many people. And that's what we want. We want them to get vaccinated. We set up the environment to be conducive for that warm, welcome for the information and the training and education. We have Baylor medical students, Prairie View nursing students there. It was just a great event, and it was cut short. So, but we're gonna call on the multi-service centers now.
Let me tell you another good Zydeco's. We've been holding these Zydeco events. I mean, we try to bring the crowds in order to get the vaccines. You got to go to where the people are. I mean, you literally have to go to where the people are. And if that means going into the clubs, we go to the clubs. It means going to the bars, we go to the bars. You want to make it as accessible as possible. The Zydeco's, all of those things. So I applaud Venus, what you all are doing, and certainly what Hope is doing. That's what I want to say. Thanks, Karen.
No, I appreciate it. And let me tell you, it really is all hands on deck. So it's important that everybody kind of work together because, the saying, we're all in this together, it's never been more important now than it has been during this pandemic. Andrea, let me ask you, just last week, the COVID-19 Vaccine Education and Equity Project, we hosted another webinar with Dr. Fauci and some other experts in this field on classrooms and students returning to the classrooms. Let me ask you, if I have children who are too young to get vaccinated, or I am around someone who's immune compromised, but I'm fully vaccinated, how can I help them stay safe?
I think the same measures that have, been implemented in the past, masking, washing your hands, keeping your distance is really critical. We have a lot of breakthrough cases right now, so it really doesn't matter if you're vaccinated. You may still be a carrier. You may be still infecting other people. So whether you're vaccinated or not, especially if you're around children and elderly, or, if you don't know if they're immunocompromised or not, or if they live with an immunocompromised person, we have to keep our masks on. They don't look pretty, but there's lots of colorful masks now. You can match them to your outfit, have some fun with them. Masks are here to stay. And I think that if you think you're going to take your mask off at the end of the year, or you're mistaken. The masks are here to stay. We have a long road ahead of us, and it's going to take a village to get rid of this virus, and we all have to chip in. And the masks are your friends. Wash your hands, keep your distance, and, zoom along.
Let me follow up with that and ask you, does the vaccine affect women or girls' reproductive health either now or in the future? That's always a concern.
I think there are a lot of myths about vaccines, and that's one of them. No, there's no effect on your reproductive cycle, on your menstrual cycle, or anything else. We've gotten really good study of the vaccines now. It's been over 9 months since we really approved the vaccines, and they've been around. Massive number of people have gotten vaccinated, and we've already heard about the immediate side effects that the vaccine could have, but we have no data of long-term side effects. And by now, that is kind of irrelevant. Vaccines usually show their side effects after 3 months, and we don't have any vaccines that you can say have long-term effects after several months or years. So I think I can assure you that you're safe, and that if you have problems with your menstrual cycle or any question, come and see us. Come to see one of the OBGYNs at Hope Clinic. And don't just blame the vaccine. Let's make sure that you're healthy. Find a medical home. And health is so much more than this vaccine. So come and see us.
Mayor Turner, let me ask you again. Statewide, cases and hospitalizations of COVID-19 are increasing. However, there are mixed messages on the importance of mitigation measures like wearing a mask. As a public figure, how do you encourage individuals to protect themselves and others from COVID-19, especially in light of the increase in the Delta variant?
Well, I point to the numbers themselves. I try not to editorialize and all of that. I just try to let the numbers speak for themselves. I would tell you about a month ago, 4 weeks ago, when I look at the numbers in our hospitals every single morning. A month ago, in our local area hospitals combined, we had a little more than 500 people in our hospitals with COVID-19. This morning, Karen, that number is 2,448. I want people for that to sink in. A month ago, a little more than 500. This morning, 2,448. And over 90% of those who are in our hospitals with COVID-19 are people who have elected not to get the vaccine. I mean, just think of those numbers. With my own city employees, 3 weeks ago, when I met with my directors to get a report, we had a little more than 40 people sick with COVID-19. As of today, that number has grown to 306. And over 100 of them, 105 are our police officers. Okay. So the numbers have been going up every single week. But what I also can say, that for those who have gotten that vaccine fully vaccinated, 99% of them are okay today. But the numbers speak for themselves. So what do we know? We know the vaccine worked. And I can tell people, and I think people in this city can tell you, I am out and about quite a bit. I mean, quite a bit, and that's from going to the churches, going to the clubs, the bars, the restaurants. But I fared quite well. I'm very grateful. But the vaccines work. Okay, they do work. And the masks, they do work. I appreciate what Andrea says. I have a mask that fits every suit that I have. If it's black, I got a black mask. If it's brown, I got a brown one. But the masks do work. And then what I would say to people, what I say to them all the time when they say, Mayor, I don't know about all of that. Let me tell you, when elected officials and others are stepping up to get the vaccine, look, we're protecting ourselves. Okay. When we're putting on these masks, it's not just because we want to put them on. They can be uncomfortable. But it is about the health and safety, not only of oneself, but I think about my own daughter. I think about my sisters and brothers. I think about people who are dealing with intellectual disabilities, that vulnerable population, seniors, So we just keep giving the message, ask people to pay attention to the medical professionals and those in the best position. And then lastly, what I would say, especially as it relates to our children, since many of our schools are now starting back again, and there's this intense conversation about the wearing of masks. What I would say, look, if you know something works, like these masks or vaccinations, I don't allow anybody to tell me what will help to keep my daughter safe. If I know wearing that mask will keep my daughter safe, you're not going to tell me not to, and I'm not going to have her to put the mask on. Mm-hmm. So we continue the message. Messaging is important for it to be consistent. The disappointing fact is that with so many conflicting other things happening, that's made it more difficult. But just put out the numbers, allow the people to meditate on those numbers, because the numbers don't lie. And then hopefully more and more people will step up to the plate and do the right thing for themselves and their children.
Yeah, I've moved to rhinestones now across my face, so I'm real decorative. Venus, let me ask you, what are some of the questions that you've been hearing frequently asked by people that, you know, you would think that by now most of the answers have been given. But what questions are you hearing most from people now that still are hesitant to take the vaccine?
Well, sadly, one of the most pressing issue that we're running into right now is that some people are being charged for their treatment. And what has happened is that when they are sick with COVID, they go into an urgent center instead of, let's say, LBJ or Bentop. They'll go to an urgent center, and they're coming back with like $400 of bills. And that word is going out into our community, you know, just this disease, it's going to, you know, kill you, yes, but what's going to kill you is the bills that come afterwards. And unfortunately, they don't understand that there's money from the federal government for treatment, but not for these urgent centers. And that's what's really sad, is that this like Mayor Turner said, the misinformation is getting to our community and it's confusing them. But we still don't have a straight answer. Treatment for COVID should be covered by the HRSA, by the federal government, yet some people are still getting charged because that's where they go for their first aid, for their medical treatment, is to these urgent center, and they're being charged, you know, hundreds of dollars.
I know and that's why we're here. We're trying to provide answers so that people will understand and we can kind of offset some of this miscommunication. Andrea, let me ask you, there's been a lot of discussion about COVID-19 boosters lately. And how do you plan to reach particularly these immune deficient persons, these patients who are eligible for that third vaccine?
Yeah, just as a matter of fact, this morning we were finalizing our policies on how we're going to provide those vaccines. As a healthcare provider, we do have a list of patients that are under either medication or have autoimmune disorders or you know, just fall under certain categories that make them eligible for the third dose. So we will be sending text messages and emails and phone calls, reaching out to them to invite them to come and get the vaccine. Pharmacies have already been seeing an influx of, you know, third dosages. And of course, there's people that, you know, are very proactive and want their vaccine immediately. And right now we do have an excess number of vaccines. We have large availability of vaccines. And so we were really preparing ourselves to reach out to people who really, really need this third booster. We want them to feel safe in the face of new variants of COVID coming ahead. I just want to also point out that as a healthcare provider, we're exhausted. We are tired. It's been a year and a half that we've been daily basis swabbing noses at the door and immunizing people. We have the tools and the weapons to overcome COVID. We must use it. This is a call to all the community and the businesses, how important it is to vaccinate people. And think about your healthcare providers. We are exhausted of seeing COVID patient after COVID patient and exposing ourselves and exposing our families and exposing our patients. And so this is a really critical time because you need your healthcare provider, and you need your healthcare provider healthy and safe and not exhausted and grumpy. So let's support each other and let's go get that vaccine.
Well, let me just follow up with you on that and just ask, are there any best practices that you would recommend for other community health centers or persons who are providing this kind of health care that can help in preparing to get that third dose?
Certainly partner. You know, we don't hold the key for everything. Like Mayor Turner said, you have to be in the community. You have to listen to their needs. And I think there's so many people don't want to be unhealthy. You know, they want to be healthy under their own terms. So going to their places of work, because people earn on an hourly basis. They don't have the hour or 2 hours that it takes to get a vaccine, you know, so make your vaccines available during the weekends, go to their places of work and give the vaccines. participate with your partners in their activities, collaborate with them, bring staff that speaks the language and understands the culture to convince people to get the immunization for them, for their families, for their children. It does take a small event. We're far from the big events now, and really working with small community partners, doing 10, 20 vaccines at a time. And that is what's going to take us to fully or increase vaccination status on our community. So I guess my best practice would be that make yourself available to what your community needs are, and work with a small every community center knows its community, so there's not like one shoe fits all. Not what I do is going to be good for someone else, but we know our community and we know our partners and we know we can support each other.
And Mayor Turner, let's return to Austin. Not this isn't political.
Must be.
The residents recently received an alert indicating that the COVID-19 situation is dire, and that while healthcare facilities are open, resources are limited due to the increase in cases. How can we work with all communities, particularly across Houston, to prevent getting into a situation where resources are scarce in local healthcare facilities?
And let me just pick up where Andrea left off. Our medical providers who've been on the front line for 18 months, they are tired and they are exhausted, and they have their families too, and their family needs. And what we are finding now is that even if there's a bed available, there may not be adequate staffing. The Harris County Health System, for example, they've set up some temporary tents outside of one of their hospitals, LBJ Hospital here in Houston. But one of the reasons why you don't have any patients there is because they don't have the staffing available. So even if there's a bed available, staffing may be very much limited. And then let me just say, the question has come, well, if I'm not unvaccinated, that's my business. It shouldn't, that's my business. It's my freedom. But let me just say this. When most of the people who are getting COVID-19 are those who have chosen to be unvaccinated, and when you get sick enough, you are going to the hospital, you are taking up space that is desperately needed by even others in the community. So let's say I'm fully vaccinated. I don't get COVID. But God forbid, let's say if somebody gets a heart attack or a stroke, or if someone breaks a leg, okay? In one case, for example, in Houston, Harris County, one person was shot 6 times, but his surgery has been delayed for about a week. No COVID, just had other problems. And so when your beds are being taken up and the ICUs are being taken up by people who elected not to get the vaccines and they end up getting COVID, it impacts everybody. It impacts everyone. It is important in our community. City of Houston is the most diverse city in the United States. I am so proud of that. That is an asset. That is not a liability. It is because of that diversity that we are the great city that we are. Okay, I'm so proud of that. But it's not just about being diverse. It's about working to be inclusive at the same time, because you can be diverse, separate, segregated, and apart. And even as we deal with with COVID, it is important that we utilize that diversity to the benefit of all of us. And that's working together, okay? Tearing down the walls and recognizing that we are impacted by what happens with our brothers and our sisters, regardless of what they look like, regardless of their orientation, regardless of their language, their religion, where they come from. This virus simply does not care. And so it should not be a political battle. This is about public health. This is about public health. This is about the people who live in our respective cities and towns. So it's my hope that we'll continue to kind of work through it. I do my best. I try not to even deal with personalities. We've worked together in the past. I just want to stay focused. And it's all about making sure that every single person in this city, in Houston, every single child has what he or she needs in order to realize their full potential. And I don't want to see another person, period, but especially for communities of color that are consistently marginalized. And whether you're dealing with COVID or you're dealing with a natural disaster, every time something like that happens, these communities are impacted more and more and more. So hopefully we'll get the politics out, whether it's in Austin or wherever, and then we'll focus on the people and recognize that that we're all in this together. And COVID, I am more scared of the virus than I am of the vaccine or any other party, whatever. I am more concerned about this virus because this virus does not care. You're a Republican, that virus is looking for you. You're a Democrat, the virus is looking for you. You're documented, that virus is looking for you. Undocumented, the virus is looking for you. Rich, poor, the virus is looking for you. And the Delta virus is saying, I don't care who you are. I will mutate and will find you if you are unvaccinated.
That Bill said, I know I was having a discussion on masks and I said, I think they would say how uncomfortable masks were. And I said, listen, it can't be any more uncomfortable than a ventilator. So take your choice, a mask or a ventilator. And when they think of it that way, that has changed some minds. We only have a couple more questions. And Andrea, let me ask you, are you finding access issues such as lack of transportation, Wi-Fi, a lack of communication in terms of vaccine availability in your area, or barriers in any way to the community you serve?
Absolutely. Absolutely. Transportation is number one. This is a huge city. It takes a lot for people to come here. And this is summer. It's hot. Even if you need to walk, 5 blocks, it may be very difficult for you to get here if you have some kind of disability or you have a child in the stroller or you have, 2 children under 5. So transportation is a big issue in this city. We know it. And we have, unfortunately, designed the city with very few sidewalks. And so I'm very big advocate of making sure that when we build and the permits go out, that there's sidewalks, that they are shaded so people can walk in the shade, and of course, safety. So those are really big things in our communities. People are used to walk. Our Hispanic communities, our Asian communities, they come from big, crowded cities where people walk. So they're willing to walk. But, look at Bel Air, one of the most, the street with most accidents. People get run by the cars all the time because we have so many few places to cross the street. And cars, people who drive, let's face it, we are not used to seeing people walking. And so they always catch us by surprise when we see people walking, and we have to change that. You talked about Wi-Fi. Certainly, it's been a huge issue for children going to school and a huge issue for telehealth. We do telehealth. We really try to break the barriers. We want to see every single patient, but it is sometimes a liability. If they call and say, I think I have COVID, I'm coughing, I can't tell them, well, come into the clinic. I have to set up a televisit. And they're in the middle of the visit and say, well, I'm running out of minutes, or there's no Wi-Fi here. That's, it's become a necessity. We're wired and we need to work on that infrastructure. But I'll say one more last thing about barriers, and it is our education system. Some of the things that I have seen in vaccine hesitancy arises from the fact that people are very illiterate when it comes to understanding health. They don't understand their bodies. They don't understand basic biology. They don't understand what the virus is or may not be. And I think that we have failed in generations after generations to educate people about biology in our classrooms. And I think we have to rethink that, because we are harvesting the neglect of many generations of education in the area of biology and healthcare. And that is one of the things that I see when I try to explain to people how the vaccine works or how the virus works or what the effects it does. It is so incredibly hard, even when people hold a bachelor's degree or even when they have finished high school. It's so hard to get through them because we have neglected that education early on. And I think those are some of the lessons learned that we need to change. And it's going to take time. It's going to take beyond probably my tenure and Mayor Turner's tenure, but we have to plant the seed for the next generation. And it's not about what we finish, but what we leave for the next generation to get done.
And Venus, let me just ask you as a follow-up to that, can you share maybe some strategies that you use that were successful in terms of combating some access issues and transportation, Wi-Fi, all the others?
Absolutely. The Telehealth Community Navigation Center, it's a cloud-based, so they just call and it goes into our cloud-based system and it's HIPAA compliant, and that's where we have a team of promotores and community health workers and also that nurse navigator who's getting that information to our community. And if they need to like I said, need to speak with a doctor, we already have that in place. I think that what's happening now with the transportation is pretty serious. We still need to have some help with transportation to some of these centers where they're vaccinating our community. So I think in retrospect, this is something that we should have had in place again a long time ago. And I don't want to hone on this too much, but we really need to engage our faith-based and community-based organizations early on in case there's another setback or another pandemic or, God forbid, another hurricane. We need to be on board early on and not as an afterthought. We really need to be part of the plan of action in order for us to be working, like you said, like partners. We are partners. I care a lot about my community and want to be available to our community health workers and promotoras, giving them all the tools they will need in order for them to effectively engage our community in vaccine confidence. And that's what we're trying to do. So those are the two things that we are really working with our community. And our, like I said, the TCN Center has been amazing. That was something that was divinely inspired. I always want to bring the Lord into this because I'll tell you, I have been blessed with this great project and it's working fabulously.
Well, it's all hands on deck, so we'll take his help too. So that works for all of us. Well, as we approach the end, of our time together, on behalf of the COVID-19 Vaccine Education and Equity Project and my co-conveners, the Alliance for Aging Research and Healthy Women, I want to thank you all for joining us. Mayor Sylvester Turner, longtime friend, Venus Janez, who, of course, I'm glad to meet and I hope to work closer with you. And of course, Andrea Caracostas. So thank you so much for participating and joining with us. And to all that joined us on this webinar today, we thank you. Because we know that the information that you gain from our experts, you will take out into the community. And again, we're all in this together. So your work and effort to help our unvaccinated get vaccinated so that we can get out of this pandemic. This has been an important and valuable discussion on building COVID-19 vaccine confidence among communities across Houston. And for any additional resources, please visit our website at covidvaccineproject.org for the fact sheets, questions and answers, a recording of this discussion, and they'll all be available soon. And of course, all of our colleagues on this call have websites that will also be helpful. The information is there. We want people to take advantage of it. And again, us all work together. Thank you again to all of our speakers. And thank you all for participating today in this webinar, and have a great afternoon.
See you, Karen.
Thanks, Sylvester.